Hello, Antonella, and thank you very much for being available for us. It's a great pleasure to have this discussion with you. I will quickly introduce ourselves. So this is Aleksei Tikhonov together with myself. We are both Young Gasteiners.
Yeah, thank you, Antonella, for joining us today. And I will introduce you for our listeners. And Antonella Cardone is a director of the European Cancer Patient Coalition. She has 25 years of experience working for nonprofits in health, social, and employment sectors. Maybe I will start with the first question. And the first question is, are you overall satisfied with the Europe's Beating Cancer plan? And what are the two things that will make the biggest impact for the cancer patients?
Thank you. So first, I would like to start by saying that the European Cancer Patient Coalition welcomes Europe's Beating Cancer Plan with its aim to improve the prevention, detection, treatment, and management of cancer in the European Union and reduce health inequalities between and within the member states. The plan sets forth actions that can support, coordinate, and supplement the efforts of member states within the remit of the EU in healthcare. So for years, the ECPC has been advocating for patients to be recognized as the most important partners and co-creators of their own health. Therefore, ECPC notes with satisfaction that the plan places the interests and the well-being of patients and the population at its center every step of the way. This approach, together with the improvement of health literacy, equal access to medicine and innovations, and the reduction of tobacco usage, is a promising reform of European cancer policy that is needed now more than ever. Furthermore, we have a lot of hope for the EU Beating Cancer Plan as a fundamental tool to reduce, if not eliminate, inequalities across Europe, also providing a framework of policy and incentives for their implementation across Europe. This is because one important point of the cancer plan is around coordinated efforts among and within member state countries. It will mobilize financial instruments to support the member states and enable the sharing of expertise and resources across the EU by supporting countries, regions, and cities with less knowledge and capacity.
Thank you. You mentioned a lot of very interesting points and crucial points. And I think linked to your last comment about how to measure it, and you said it also at Gastein, right? What gets measured gets done. But what exactly should we measure to make it happen?
Well, one major obstacle during COVID-19 has been the difficulty in assessing the impact of the pandemic and comparing interventions and public health measures adopted in different regions and countries due to lack of comparable real-time data. So a value-based system that is driven by high-quality comparable data, including outcomes that matter to people and patients, that can be collected and analyzed in real time is essential. So yes, we believe that what gets measured gets done, notably monitoring and reporting on key indicators at EU level can help chart progress and target the improvements. So in ECPC, we believe that the EU must encourage the adoption of harmonized health data standards and open exchange of formats for electronic health records. This framework should be evidence-based and continually evolve as common indicators become agreed upon and available. Last but not least, I needed to mention that COVID-19 has taught us that the regulations must include not only European data, but also global data, especially for scientific research that includes forms of rare cancer.
Yeah, thank you, Antonella, for underlining such important points. And you mentioned COVID. And regarding this, the effect of COVID on cancer patients were considerable. And could you please give us one example where the impact was the biggest?
Well, first I need to mention that in 2020, 2.7 million people in the European Union were diagnosed with the disease, and another 1.3 million people lost their lives to cancer. So we acknowledge that the year 2020 was an incredibly challenging year, with the pandemic changing how we live and work in a short amount of time. This took a particular toll on the healthcare sector, with the hospitals overrun and many ongoing treatments postponed, affecting high-risk groups with cancer patients among them. It has severely disrupted cancer care and revealed the weaknesses of health systems in Europe. Limited hospital capacity, lack of personal protective equipment for healthcare providers, lack of point of care testing, and the higher death rate of COVID-19 in immunocompromised hosts make the patient burden more challenging for every aspect of healthcare. So during the first months of the pandemic, data from Italy reported that more than 20% of all COVID-19 mortality was among cancer patients. This made cancer patients afraid of COVID-19 more than cancer. They often suspended not only screening programs and follow-ups, but also the treatment. So the pandemic has been endangering cancer patients directly and indirectly, putting them at a higher risk for more severe forms of the disease. Regrettably, with approximately a 40% drop in diagnosis of cancer in 2020, the pandemic will negatively affect cancer outcomes in the near future, especially with the screening and follow-up consultations suspended for a period of time.
Yes, so you mentioned patients not getting diagnosed, also funding going to COVID, and COVID will remain with us in the next few years. So how can we make sure that cancer still has its high place on the EU agenda?
Well, health system resilience has been rising in the political agenda throughout the last decade, becoming a key political priority. Before Europe's Beating Cancer Plan was launched, Europe has been working on tackling cancer for decades. Despite efforts to address cancer care and research in recent years, cancer remains one of the leading medical and societal challenges of our time. Cancer is an individual diagnosis that has important impact on patients, but it also severely affects the lives of their families and friends. So this is why we still need to ensure that cancer remains high on the political agenda beyond the conclusion of the work of the Europe's Beating Cancer Plan and EU Cancer Mission, as we will be ensuring not only the development of the plan and the mission, but also their proper implementation. More specifically, at ECPZ, we have a strategy in order to influence and contribute to shaping the European and national political agenda on issues related to cancer diagnosis, treatment access, cancer patients and carers' quality of life, cancer survivorship, including rare cancer. So we continue to build new and strengthen existing alliances with relevant partners and stakeholders, including medical societies, research, and patient organizations. We promoted the dissemination and implementation of the joint action on rare cancers recommendations at both the national and European levels. We represent the voice of cancer patients throughout the development and implementation of the European Cancer Mission and Europe's Beating Cancer Plan, also through a new parliamentary intergroup on cancer, for which we manage the secretariat. We also promote the concept, uptake, and implementation of survivorship through cancer plans at national and European level, focusing on the right to be forgotten the right to return to work and the right to follow up. We leverage the membership base for advocacy, disseminate information, and provide members with the toolkits to carry the messages at national level. And finally, we monitor the implementation of key European legislations, such as the Cross-Border Healthcare Directive, the Work-Life Balance Directive, the legislation on HTA and shortages of medicines, and proactively develop position papers.